Hi parents, here are some dental tips for your children. First thing first is to establish a dental home with a pediatric dentist, and that could begin as early as your child was in the womb. So if you miss the bus when the child was in your womb, you can come to us when your child's first tooth erupts. And you basically need to start cleaning your child's teeth with a soft toothbrush or a damp cloth, and schedule a visit to the dentist by the time that your child is 1 year old. You need to brush and floss regularly. Flossing will start when all your child's milk teeth have come inside the mouth and have established contacts, because just brushing is only going to take care of the top surfaces. But a lot of time plaque accumulates between the two teeth, and that can only be disrupted when you start using floss. Third important point is to use a fluoridated toothpaste. A lot of parents have this fear whether the child will swallow it, whether they will develop fluoride toxicity. Please understand, 1000 ppm has been recommended by the International Association of Pediatric Dentistry. What is more important is the quantum of the toothpaste that your child is using, if the child is spitting and if the child is not spitting. So all of this guidance can be given to you if you've established a dental home with a pediatric dental office. Now, sugar is considered as the arch criminal. All those bacteria eating on your child's tooth, they basically feed on sugars, and that leads to production of acids, and that leads to weakened tooth structure. So make sure that you limit your child's sugar intake. A simple tip would be to decide on a chocolate day in a week, when during that time your child needs to keep accumulating the chocolates, and he's allowed to eat. Maybe if you've decided a Sunday, you decide on a specific time, and only during that time and on that Sunday will he be allowed to eat as many chocolates as possible during that 1 hour or 15-20 minute period. If your child is into contact sports, make sure you get a custom-made mouthguard fabricated for your child. Monitor the tooth development, because your child is in a growing phase, in a dynamic phase. A lot of changes happen inside your child's mouth once the child turns 6 years of age. Last but not the least, set a good example. Your child watches you. Your child is a reflection of you. So make sure that you yourself are taking good care of your oral health, because your child is going to implement what it's seeing. So if your child is seeing, make sure that during the initial years the child is brushing alongside with you. And once the child gets independent, when the child is able to tie its own shoelaces, make sure that at least the night brushing is being monitored by you guys along with the flossing. Thank you.